Good afternoon. It's February 8th. It's 3 p.m. and welcome to the Louisville Metro Opioid Settlement Distribution Advisory Board. Thank you for joining us this afternoon. Thank you for your time and all the effort that our members put into reviewing and evaluating the proposals we received. We are grateful for the volume and quality of proposals we received and just all of the what contributes to the health and wellness and improvements through our city. They show that our community's commitment to opioid abatement work. Today, we'll share an overview of the process to this point, categorically a categorical overview of the board's findings and recommendations and next steps in towards the final funding decisions. And then we're also going to share some of the Louisville Metro Public Health and Wellness's prevention strategy that will guide our internal work. So on some of the notes on how we arrived to this point. So we as members of Louisville Metro Public Health and Wellness staff and team members attended community listening sessions on opioid settlements for the state and locally, and the community informed and identified our priorities for funding, and those were embedded into the request for applications. And that would be, as we've discussed several times, prevention, treatment and recovery, support, and homelessness. So this is a huge impact. It's a huge issue that impacts all of our residents, and all of our residents have a stake in solving it. So we're grateful for the large number of organizations already working in this space and residents who are making their voices heard to ensure that these funds best serve the community. This is evidence. This is a community-wide investment. So the themes emerge throughout our work and the community priorities for funding. These also align with the health department's focus on root causes of health. And our findings suggest that residents who experience the greatest barriers to housing, transportation, and access to treatment also experience disproportionate impacts of the opioid crisis. So we also consulted with community partners about their experiences navigating through other funding streams and worked to build a more streamlined application and publicly share evaluation criteria. So we put out the request for applications for this second disbursement of funding in late October. We did hear back soon from the applicants that the timeline for its submission was short, a little tight, particularly being around the holidays. So we extended that deadline to early December. We received 60 applications that closely align with community funding priorities. Those most closely aligning were reflected in the request for applications that were scored by the board to determine our funding recommendations. So at this point, I'm going to turn over the presentation to Kalisha Comley, who is the Louisville Public Health and Wellness Opioid Abatement Settlement Coordinator and a member of our Behavioral Health Equity team.
Hello, everyone. So I'll share a brief summary of our funding recommendations. As mentioned, we received 60 applications for the disbursement 2, which we organized into the 3 categories based on community funding priorities: prevention, treatment and recovery support, and homelessness. So as you can see here on this table, for the applications submitted, we received 10 that were focused on prevention, 32 focused on treatment and recovery support, and 6 focused on housing and wraparound services for people experiencing homelessness. You'll also see an other category there as well, which included applications that were either incomplete or that fell outside the scope of the request for applications. So with the funds, the $5.3 million in funds that are available in this second disbursement, the board is recommending 21 applications, which include 5 for prevention at a bit over $650,000, 12 in treatment and recovery support at a bit over 3.5 million, and 4 that focus on homelessness at just over 1.1 million. So as Connie mentioned, we at LMPHW know that we can't address this issue on our own, and we are just so grateful for so many community partners that are willing to step up to meet the needs of our residents. This second disbursement of opioid settlement funds will allow us to fund some of our community partners to continue doing the phenomenal work that they are doing. That also means that many proposals that are not being recommended for this distribution would also contribute to health and wellness improvements. So the board will be reviewing opportunities to connect applicants with other funding sources. And also we here at LMPHW can work with applicants to strengthen connections to opioid settlement goals to help make them more competitive in the future. So I will turn it over to Dr. Single to talk about next steps.
Thank you, Kalisha. So let me start by echoing Connie's sentiments. I truly appreciate all the community partners who are working so hard to serve the most vulnerable people in our community. And I definitely want to thank the Opioid Advisory Board members and the Lowell Metro Health and Wellness team who have worked countless hours on this project. I know it was not easy. So the next step in the process will be, board will be sending these recommendations to the mayor's office before February, in the next few days. And once we have received mayor's approval, we will inform all the applicants, and then it will go to the council, Metro Council Budget Committee, and then all those applications will go to the full Metro Council. Once the Metro Council has passed an ordinance approving the distributions, Lowell Metro Health will work with all the organizations and will get all the contracts and agreements executed, and then the funds will be distributed. I'll pass it on to Ben for some comments, and then we'll turn back.
Strategy. There was a robust discussion about prevention at the last meeting, and our department just like to share some of our department-wide strategy, specifically as we're talking. So as we mentioned last time, this also is an alignment with the Johns Hopkins School of Public Health document. That's one of our guiding documents that focuses on their best practice recommendations for the use of opioid settlement funds, but also aligns with our long-term advocacy to prioritize prevention. It's really among the hardest to fund interventions, particularly at the scale that we're talking about in our city. But the benefits that we can potentially reap down the line in reducing the demand for all of the other interventions that we currently are using around behavioral health are really dramatic and outweigh upfront costs. So as maybe a refresher for some of you all, really prevention, the best prevention doesn't just prevent a specific health behavior like opioid use, but has the potential by addressing unmet social, emotional, and environmental health needs of young people to reduce both substance use disorder, but also other social issues that our community faces, including gun violence and homelessness, poor school behavior, high dropout rates, and subsequent legal system involvement. Evaluation or cost benefit analysis of prevention programming found that of health investments, it's among the best investment, as every dollar that is spent on prevention reaps a $18 return on investment in both reduction of cost to medical care systems, legal systems, but also other government agencies that provide supportive social services. And we know that our investments that we're making this round around prevention, no amount of the settlement dollars will be adequate to address the wide variety of social, emotional, and environmental needs of our community's young people, but often strategic investments can act as a catalyst for additional investments in other cost-effective interventions to support healthy and resilient youth. So just a quick vocabulary piece. The term primary prevention came up last meeting. I was asked to provide a little bit of additional information regarding sort of these distinctions and tiers. When we talk about primary prevention, this is most often when we're talking about youth prevention. And in terms of substance use, we're really talking about preventing a person's initiation of substance use, but also preventing substance use from becoming problematic substance use. Secondary prevention focuses on people who have already begun using substances and tries to promote safety and prevent that substance use from leading to negative health outcomes, including substance use disorder. While tertiary prevention, this is really the harm reduction that the first round of funding was focused on, which is reducing the harm specifically among people who are in substance use that's most associated with negative health outcomes and people with opioid use disorder and substance use disorder. So these interventions are really the sorts of things that we talk about with overdose education, naloxone distribution, and outreach services, and other community partners providing syringe services, linkage of people who have experienced overdose or who are experiencing substance use disorder to treatment, including medication for opioid use disorder, and really, recognizing that a diagnosis of a substance use disorder is an indication of an opportunity for services. It's not an outcome in and of itself. The most negative health outcomes associated with substance use can still be prevented by investing in tertiary prevention. And really these three elements ideally are kind of working in collaboration, right? We should also be doing tertiary prevention with our young people, because a young person who consumes one counterfeit fentanyl laced pill, who does not have an opioid use disorder, who has not used opioids before, is at risk of dying of an overdose because their body would react to that opioid regardless of if they have an opioid use disorder. So we in our department advocate for across the board prevention, with really the most opportunity in our community primary prevention. And then youth promotion. This is another term that I was asked to provide a little bit of context on. Really, prevention has a bit of a negative connotation in the sense that it's really focused on what we don't want young people to do. I'm of the DARE generation, so I was told in my elementary school about how terrible drugs were and how I shouldn't do drugs, and that if someone comes up to me and offers me drugs, I should say no. A rigorous analysis of that approach has found that that kind of fear-based and focusing only on negative components, the Just Say No campaign as well, really is not an effective way to reach youth. And so youth promotion really is focused not on telling young people what not to do, but by offering a diverse range of activities and pro-social, healthy ways for young people to spend time, and really just investing in youth development. So this is similar to the Icelandic model, where we see there are components where they have like a curfew and prevent young people from being out late. they do educate young people about substances, but most of their investment really actually is going into providing positive experiences for young people, providing opportunities for them to develop resiliency, addressing the root causes of harmful behavior, recognizing that 3 p.m. to 6 p.m., that kind of out of school block is one of the highest likelihood times for young people to engage in behaviors associated with risk, and that providing an alternative rather than just saying don't use drugs in those 3 hours, but really restructuring society so that our young people have independence, but also the support to do positive things in those hours is as effective, if not more effective, than just kind of badgering them not to do the thing to do. So the 3 goals that I alluded to in our last meeting around prevention in Louisville Metro are, and these are all 3 kind of evidence-based best practices. We didn't vet these. We're not cutting edge on this. This is a pretty widely doctrinaire approach to modern day prevention. It focuses on primary prevention programming. In many jurisdictions, this is school-based, but really the important part is that making sure that every young person is exposed to primary prevention programming. Second goal of making sure that all young people, but particularly those at higher risk of developing unhealthy behaviors, have access to robust mental health care, mental health services. And then lastly, this youth promotion piece of having an environment where our young people have access to meaningful extracurricular activities and safe spaces. Not to dwell on my own childhood, but when I was a young person, I could go all over the city by myself. I could go to the park by myself. Now, as I'm raising a child in 2024, our culture has shifted to a place where we're not as comfortable as a society, allowing kids to have free reign of the city. And while that may protect them some outcomes, it also is leading to some negative health as well. So like all of our work, this is not something that we think the health department can do by itself. In fact, we know that the majority of this work will not be the health department. The health department is tasked with providing a strategy around public health and sharing that strategy with the community, convening stakeholders, and trying to help build movement around the most pressing public health concerns. And so we recognize that this will require not only our efforts, but robust community engagement and ongoing commitment. We have seen our community step up, and a large number of stakeholders want to be involved in this work. And so we're hoping we can build a community where our young people have both the resources and the opportunities to flourish. Back to Dr.
Thank you, Ben. Truly appreciate this. Great work being done by Louisville Metro Health team here. So I want to thank people who are joining us virtually, and we look forward to continuing this community-wide effort to prevent substance use and address the needs of people who experience the greatest barrier to accessing harm reduction, treatment, and recovery services. I know for sure that together we will make a difference. I'd like to open the floor if advisory board members have any questions or comments, or anyone.
Dr. Single, before we finish up, I did want to mention, we talked about providing the funding for the various programs and how that will go through the Metro Council improvement process. At that time, as Kalisha mentioned, we'll be establishing those grant agreements, but also working with Kalisha and Dr. Murillo, who's our external evaluator, and ensuring that we have performance measures, and so basically the way it works, that as grant agreements are finalized, a quarter of the funding is provided at that time, and then we'll be following up regularly throughout the project period. Again, reviewing performance measures, objectives, and those things listed in the program. So even once the funding is allotted and provided, there's still a lot of work to do in the coming year. So
Thank you, Connie.
Well, I don't have a question, but I'll just jump in and just say, I just want to thank you, everybody, for your work for this. I appreciate the transparent process, making sure that it's been very rewarding, hands-on, and I think we're an ecosystem and we're all working for the same thing. And so, just appreciate everybody who's put all their energy and work. Time is valuable to each and every one of us, but I thank you all, the advisory board members, and also all the people who've been really hands deep.
yeah, Councilman Baker, we've lost your audio.
Okay, now he muted himself. Thank you, Phil.
No problem. Thank you.
I would also like to just comment that I am so extremely encouraged by the number of people in this community that are involved in saving lives and saving people's happiness. And having been down the road of active addiction to heroin and then pain pills, and off and on with it for close to 30 years. I just, the misery it's incredible. And the people here that are involved in this committee, but also the people that are involved in in the winners, if you will, of the funding, are all doing such important and great work that I'm encouraged about our future. And when you're looking at the day-to-day losses, I'm almost at the point where I only count the wins, and because there are so many losses. And frankly, before I started this activity, I was pretty negative about the potential, the hope of turning it around in not just our community, but in most of America's communities. And I've got a new a new sense of hope, that we're making a difference, and we're gonna save lives and change lives one person at a time, if that's what it takes. But I want to thank everybody for allowing me to be part of this process, but also for all that you all are giving, for this process. I can't think of a more important social issue right now because it touches so close to home. Thank you.
Thank you, Lee. Appreciate this. If everyone is good, I think if no questions or no comments, I think we'll adjourn the meeting. Once again, within a couple of days, we'll be sending these recommendations to the mayor. As soon as mayor approves and sends it to the council, we will be informing all the applicants. So stay tuned, coming quickly. Thank you, everyone. Truly appreciate you all. You're doing great work.
Thank you.